If you have chronic lower back pain, stretching it may be the worst thing you can do. Here's the finding that flips everything. In a large group of people with ongoing back pain, the ones who stabilized their spines instead of stretching them got better, while many who kept reaching for their toes stayed stuck or got worse. The relief you're chasing through stretching is often a trap, and the real fix is almost the opposite of what your instincts tell you. Most people believe back pain means tightness, and tightness means you need to stretch. It feels obvious. Your back aches, it feels stiff, so you bend and reach and pull, and for about 20 minutes, relief. So you do it again the next day, and the next, for years. Here's what almost nobody tells you. That 20-minute relief is fooling you. When you stretch a back that's already unstable, you're not loosening a tight muscle. In many cases, you're stretching ligaments and tissues that were already overstretched, and the brief relief you feel is a temporary numbing of pain signals, not actual healing. This idea comes straight from one of the most respected spine researchers alive. Dr. Stuart McGill, Professor Emeritus at the University of Waterloo, spent over 30 years studying the mechanics of the human spine in his laboratory, testing real spinal tissue under load. His conclusion challenged decades of advice. For many people with chronic low back pain, repeated spinal flexion, bending and stretching forward, is part of what's driving the pain, not curing it. Think of it this way. Picture a credit card. Bend it back and forth once, nothing happens. Bend it the same way a few hundred times, and it cracks at the fold. McGill argued your spinal discs work the same way. They have a limited number of bends in them before damage accumulates. Every unnecessary forward stretch may be spending bends you can't get back. So if stretching isn't the answer, what is? The real question is why your back hurts in the first place, and the answer isn't tightness, it's instability. And fixing that requires doing almost the exact opposite of what feels good. Let me explain what your lower back actually needs, because once you understand it, the whole stretch it out instinct falls apart. Your spine has two competing jobs. It needs to move, bend, twist, reach, and it needs to stay stable, holding you upright and protecting the delicate nerves running through it. Here's the key insight most people miss. Those two jobs belong to different parts of your back. Your lower back, the lumbar spine, is built primarily for stability. The mobility, the bending and twisting, is supposed to come from your hips and your upper back. When that arrangement breaks down, trouble starts. If your hips get stiff and your upper back gets locked up, which happens to almost everyone who sits for a living, your body still needs to bend somehow. So it borrows the movement from the one place that wasn't designed for it, your lower back. Now your lumbar spine is doing a job it was never built for, bending repeatedly where it should be staying solid. That's where the pain lives. This is the Feynman simple version. Imagine a stack of plates with a soft jelly cushion between each one. As long as the stack stays straight and stable, it carries weight beautifully. But start bending that stack forward, over and over, and the jelly cushions get squeezed toward the back edge, where the nerves are. Do it enough, and the cushion bulges or tears. That's a disc problem, and it's driven by repeated bending, exactly what stretching encourages. So what does your lower back actually need? Not more flexibility. Stiffness, the good kind. McGill calls it stiffness or core stability, and it means training the muscles around your spine to brace and hold it steady while your hips and shoulders do the moving. A stable spine is a pain-free spine for a huge number of people. Here's the research that backs this up. A foundational study in the field of core stabilization, work by Australian physiotherapists including Paul Hodges, found that in people with low back pain, a deep core muscle called the transversus abdominis fired late or failed to fire properly. In healthy backs, this muscle activates a fraction of a second before you move, tightening like a natural weight belt to protect the spine. In painful backs, that automatic bracing was broken. The spine moved before it was protected. Read that again. Your deep core is supposed to fire before you move. When it doesn't, your spine takes the hit. And here's why stretching makes this worse for many people. When you stretch a painful back, you often trigger something called the stretch reflex's aftermath. The muscles around the spine briefly relax and the pain quiets. But you've done nothing to fix the broken bracing. You've actually made the spine temporarily looser and less protected. So the underlying instability stays. The disc keeps getting loaded badly, and you need to stretch again tomorrow just to get the same relief. It's a loop. The relief is real, but it's borrowed against your spine's future. This doesn't mean all stretching is bad for everyone. Some back pain genuinely involves tight hip muscles, and stretching those can help enormously. The research is still evolving on exactly who benefits from what. But for the large group of people whose pain comes from instability and repeated bending, more spinal stretching is fuel on the fire. But knowing your back needs stability instead of flexibility is only half the picture. Because there's a second factor, something happening in your brain, not your back, that explains why your pain can persist long after the original injury healed. And what's happening in your nervous system is more important than what's happening in your spine. The second reason your back pain won't quit has almost nothing to do with your back. It's in your nervous system. And this is where chronic pain becomes genuinely different from a fresh injury. Here's the mechanism. Pain is not a simple signal traveling from your back to your brain like electricity through a wire. Pain is something your brain produces after weighing signals from your body against everything it knows: your memories, your fear, your stress, your past experiences. Your brain is constantly asking one question: how much danger am I in? And it cranks pain up or down based on the answer. Now here's what happens with chronic back pain. When pain signals fire from your spine over and over for months, the nervous system adapts in the wrong direction. The nerve pathways carrying those signals become more sensitive, more easily triggered. Scientists call this central sensitization. Your pain volume knob gets stuck turned up. Eventually, movements that aren't actually dangerous, bending to tie your shoe, sitting too long, get flagged as threats and produce pain, even though no real damage is happening. Think of it like a car alarm that's been set too sensitive. At first, it only goes off for a real break-in. But after months of misfiring, now it screams when a truck drives past, when the wind blows, when someone walks too close. The alarm isn't broken, it's overprotecting. Your pain system does exactly this. Here's the empathy moment. If you've had back pain for years, and scans show nothing dramatic, and doctors shrug, and you've started to wonder if it's all in your head, it is not in your head. The pain is completely real, but its source may have shifted from your spine to your oversensitized nervous system. And that's actually good news, because a sensitized nervous system can be calmed back down. A crumbling disc is hard to reverse. An overprotective alarm can be retrained. If this is making sense, and you want the part that ties it all together, the actual movements and the protocol that retrain both your spine and your nervous system at once, subscribe now. It's coming in just a few minutes, and it's the part that genuinely changes outcomes. This is also why fear makes back pain worse, and it's not psychological hand-waving. It's mechanical. When you're afraid to move your back, you tense up, you guard, you avoid motion. But your spinal discs feed on movement, remember? They have no blood supply and pull nutrients in through motion. So fear-driven stillness literally starves the tissue while teaching your nervous system that movement is dangerous. Researchers call this fear avoidance, and studies have repeatedly shown it's one of the strongest predictors of whether acute back pain becomes chronic. Not the size of the disc bulge, the fear. The thing that predicts long-term back pain best isn't what's on your MRI. It's how afraid you are to move. In fact, here's a fact that stuns most people. Studies scanning the backs of people with no pain at all found that a huge percentage of them had disc bulges, degeneration, and abnormalities on MRI and felt nothing. One analysis found that among pain-free adults in their 50s, a significant majority had disc degeneration visible on imaging. The damage was there, the pain was not. Some scientists dispute how to interpret this, but the takeaway is hard to ignore. What shows up on a scan often does not match what you feel. So now you understand the two real drivers: an unstable spine that's been bending where it should brace, and a nervous system that's been turned up too high for too long. Stretching addresses neither. It often worsens both. But none of this matters if you don't know exactly what to do instead. Because the solution isn't to stop moving. That makes everything worse. It's to move in a very specific way that rebuilds stability and calms the alarm at the same time. And that protocol is more precise than you think. What almost nobody talks about is that the fix for chronic back pain is not rest, and it's not stretching. It's a specific kind of movement that makes your spine stable while keeping it moving safely. McGill spent decades narrowing this down to a foundation, and the surprise is how gentle it is. He found that 3 specific exercises build spinal stability without bending the spine in the dangerous, repeated way that stretching does. He calls them the Big 3. They're not impressive looking. They don't make you sweat. but they train the exact muscles that fire late in people with bad backs, and they do it while keeping the spine in its strong, neutral position. Here's the principle behind all three, and it's the counterintuitive heart of this whole approach. To heal a chronic back, you train the core to brace and hold the spine still while your arms and legs move, the opposite of stretching. Instead of teaching your spine to bend more, you teach it to resist bending. McGill's lab showed that this builds the kind of endurance and stiffness that protects the disc and shuts down the pain-driving micro-movements. And here's the most overlooked part. It's about endurance, not strength. McGill's research found that people with healthy backs didn't have stronger core muscles than people with bad backs. They had core muscles with more endurance, the ability to hold a brace steady over time. Your spine doesn't need a brief burst of power. It needs muscles that can quietly hold it stable all day. That's a completely different training target, and it's why grinding out sit-ups, which bend the spine repeatedly, the exact wrong motion, often makes back pain worse, not better. Sit-ups, the exercise millions do for a strong core, is one of the worst things for a vulnerable spine. Read that again. There's one more piece, and it's the part that addresses your nervous system. The way you recover from a back pain flare matters enormously. The old advice was bed rest. We now know that's among the worst things you can do. Prolonged rest deconditions the muscles, starves the discs, and teaches your oversensitive alarm that movement is to be feared. Modern guidelines from major pain research bodies now recommend staying active within tolerable limits, even during a flare. Gentle, confident movement tells your nervous system, this is safe. That's how you turn the alarm sensitivity back down. This is the reframe that changes everything. You're not fragile. The dominant message of modern back pain science, championed by researchers like Professor Peter O'Sullivan in Australia, is that for most people, the back is strong, robust, and adaptable, and that the belief that it's fragile and damaged is itself a major driver of ongoing pain. When you stop treating your back like glass and start moving it with calm confidence, the pain system often settles. Some clinicians push back and emphasize that a minority of back pain does have a serious, specific cause: fractures, infections, nerve compression that needs real medical attention. That's true and important, and it's why genuine red flags should always be checked. The research is still evolving on exactly where each person falls. But for the large majority, the ordinary, non-specific chronic back pain that frustrates millions, the picture is consistent. Stability, gentle movement, and a calmer nervous system beat stretching and rest. So the question becomes, if your back needs stability instead of stretching, and confidence instead of fear, how do you actually train it? What do you do tomorrow morning? Here's the protocol, built on McGill's Big Three plus the nervous system piece. Start gently, and if you have severe pain, leg numbness, or any red flag symptoms, see a professional before beginning. With that said, here's what to do. First, the curl-up, not the sit-up. Lie on your back, bend one knee, keep the other leg straight. Place your hands palm down under the small of your back to keep your spine in its natural curve. Do not flatten it. Now lift your head and shoulders just an inch or two off the floor, keeping your neck stiff like it's part of your upper body. Hold for about 10 seconds. Breathe normally. Lower. That's 1 rep. The genius here is that you brace the core without bending the spine. Do a few reps, switch which knee is bent, repeat. Second, the side plank, modified. Lie on your side, propped on your elbow, knees bent at 90 degrees. Lift your hips so your body forms a straight line from knees to head. Hold 10 seconds. This trains the muscles along the side of your spine, the ones that stop dangerous twisting, without loading the spine in a risky way. As you get stronger, straighten your legs for the full version. Do both sides. Third, the bird dog. Get on hands and knees. Brace your core gently, as if someone were about to poke your stomach. Now extend your opposite arm and leg straight out, keeping your back flat and still as a table. Imagine balancing a glass of water on your lower back. Hold 10 seconds. Return. Switch sides. This teaches your spine to stay stable while your limbs move, exactly the skill real life demands. For all three, use what McGill calls descending pyramids for endurance, not strength. More reps with shorter holds, never pushing into pain. Do them daily, ideally in the morning, but not first thing out of bed, because remember, your discs are fully water swollen overnight and most vulnerable to bending in the first hour. Wait an hour after rising. Fourth, stop bending from your spine all day. Learn to hinge from your hips. When you pick something up, push your hips back and keep your spine in its neutral, braced position, letting your hips and knees do the work. This protects the bends you have left. Fifth, keep moving through the day and through flares. Walk daily. Don't rest in bed when pain strikes. Move gently and confidently. Every calm movement tells your nervous system the alarm can stand down. If even one of these was new to you, hit the like button. It tells the algorithm to show this to more people living with back pain who've been stretching for years and getting nowhere. Dr. Stuart McGill has used this exact foundation with patients ranging from disabled office workers to world record powerlifters, and his core message has stayed the same for decades. The spine doesn't need to be stretched loose, it needs to be trained stable. You now understand something most back pain sufferers never learn, that the relief you've been chasing was pointing you in exactly the wrong direction. Step back and look at what's really happened here. For decades, the instinct was simple. It hurts, so stretch it, rest it, treat it like something broken. And millions of people followed that instinct faithfully for years and stayed in pain. Not because they didn't try, because the advice itself was pointing the wrong way. That's the quiet tragedy of chronic back pain. So much of it is maintained by the very things people do to fix it. The stretching that destabilizes, the resting that deconditions, the fear that keeps them frozen. The back isn't a fragile thing that needs to be protected into stillness. It's a strong, adaptable structure that needs to be trained, trusted, and moved with confidence. And here's the part I find genuinely hopeful. The fix costs nothing. No equipment, no surgery, no endless appointments. 3 gentle movements, a different way of bending, and a decision to stop being afraid of your own spine. The body wants to stabilize. It's been waiting for you to teach it how, instead of pulling it apart. I want to hear from you. Drop a comment below. How long have you been stretching your back, hoping for relief? And did anyone ever tell you it might be making things worse? I'd bet a lot of you have been doing the same toe touches for years, faithfully, never knowing. Here's the truth to carry with you. Your back doesn't need to be looser. It needs to be trusted. Share this with someone who's been fighting back pain and running out of answers. This might be the reframe that finally turns it around for them. And if you haven't subscribed yet, do it. But what I've been researching for next week builds directly on this, and it's something I've spent months putting together. Your back was never broken. It was only waiting to be trained.